Well, the low and middle income countries have been challenged to rethink their budgets to ensure more funds are allocated to the health sector, particularly towards dealing with non-communicable diseases.
The funding gap has been widened by the withdrawal of donors, leaving countries scrapping for alternative means of sources for funding. The calls were made during a workshop on health financing for non-communicable diseases in sub-Saharan Africa.
The workshop brought together stakeholders from 8 countries, including Kenya, Uganda, Somalia, Ghana, as well as Malawi. Non-communicable diseases account for 41 million deaths worldwide, with 77% occurring in low and also middle-income countries.
The government is taxing, have put excise taxes on tobacco, alcohol, and sugar-sweetened beverages. We are also advocating for, taxes also on ultra-processed food, because all of these products increase our disease burden. And like I mentioned, not just taxing them, the revenue is currently increasing. So if it's increasing, why don't you earmark, at least a portion of it, to go and support, people suffering from non-communicable diseases.
The conversations on raising resources can be very difficult because there's always a lot more that is needed than what is available. And so what we aim to do is look at, from the pot that already exists, what more can be channeled to non-communicable disease, but also the other perspective is from what we have already raised, can we do better?
We don't want to equate donors going away with an increase in out-of-pocket expenditure. Because as we speak today, out-of-pocket expenditure is over 24%. So if you say, okay, now let's address the donor gap by increasing the out-of expenditure, then you're putting people into catastrophic spending.